Hi, I'm Jolene and I'm your nurse today. The doctor has ordered for you to have your central line dressing changed. I verify my patient's name, date of birth, and if they had any allergies specifically to tape or adhesive. So I would go ahead and wash my hands with hand sanitizer. I would then put on my patient's mask. I would go ahead and put on a pair of clean gloves. And I would put on my mask as well. And now I'm going to remove the old dressing, starting from where the lumens are, just 'cause it's easier to pull it up from there. And then I would remove the dressing in the bio patch. And I would discard my gloves and wash my hands again. And I'm also going to assess the site, just noting for any redness, swelling, or if the patient is experiencing any tenderness. And then around the site where the catheter is inserted, or just make sure that there is no drainage coming from that. I'm now going to set up my sterile field. And I'm going to put on my sterile gloves. I'm going to place this near the patient with the lumens on it. And now I'm going to drop in my positive pressure caps. And my bio patch. And I would also expel any air from my saline syringes. I am now going to get my ChlorPrep ready. Just make sure that the antiseptic is coming out, and I'm going to go ahead and vigorously clean around the area for 30 seconds. Making sure to get the insertion site as well as around it. Then I would also clean the catheter part that's sticking out, and then just a tiny bit down the lumen here. And I would allow that to air dry. I'm now going to place my new bio patch with the blue side up. And I'm going to apply my new dressing. And I would be checking in with the patient just to make sure that he or she wasn't in any pain during this process. And I'm going to date, time, and initial, and place that on my transparent dressing. I'm now going to use alcohol swabs just to make sure that the lumens are clean. And now I'm going to remove my Kuros cap and the old pressure valve and discard those. I am now going to scrub the site, the area here, for 10 seconds with an alcohol swab. I'm going to let that air dry. I'm going to make sure that the lumen is unclamped. And before I would unclamp it, I would apply my new positive pressure valve and attach my normal saline syringe. I'm now going to unclamp it and aspirate just to check for normal blood return and noting if it is brisk or sluggish. And I'm going to flush with the entire syringe using the push-pause method, making sure to check my insertion site for no swelling and to make sure that the patient isn't experiencing any pain. And I'm going to clamp my lumen. And remove my syringe, applying a new Kuros cap per hospital policy. And then I'm going to clean up here and make sure that the patient is safe. And then I'm going to document my procedure regarding the site, how it looked, how the patient felt, and about the blood return when I aspirated.